Hello, welcome everyone. On this quick short video, we're going to see two different websites that deal with health product. One is HealthSherpa.com. The other one is National General Product. HealthSherpa, it's used to quote the ACA or the Obamacare product, and you can easily tell whether someone might or not qualify for a subsidy. And National General is your go-to place for the short-term medical for those people that might not qualify for a subsidy, those people that just need a short-term medical for up to 3 years. You also find on that website all the accident, ancillary, and different products that they use, and they're both super easy to navigate.
So once you read your Health Sherpa, and you can see that this one has got the number, your everything, and the client can really come over here and sign up and quote themselves without even signing. Without signing in. You can send this link to any customers and they can sign up themselves. But for you to track your customer that you're talking to, you want to go ahead and click sign in. You want to make sure that you have your signing and everything enabled so that you can really go and see if you got leads, your clients, any referrals, any marketing. Under marketing, you can, if you forget your link, you can come over here, copy it, upload a logo. You can customize your background. You can customize your pictures. Insights, it'll tell you the number of leads, the submitted application, the average plan premium, and the total annual premium that we're closing. As you can see, we're gonna start in October and we're gonna take it month by month. Anytime you can come and click get started right here, and I want you to click on there and watch the overview video. I need you to watch the overview video because this is not listed. This is in YouTube, but it's a non-listed video, so you're never gonna find it. It's 6 minutes and you wanna watch that. I want you to click on read the getting started guide. That's really read the getting started guide. I need you to run a quote. So those are the first three are the ones that are the most important for you right now. Watch the overview, read the getting started, and run a quote. Once you're able to do that, then we're going to continue with some of the training, but it all starts right here in the getting started link. Everything starts obviously with running a quote. If you can find the quote button right here, we're going to start with the zip code, and I'm going to make one really simple. Obviously, some of the zip codes, you'll find out that they are in 2 or more counties. So you got to ask the client, is the county correct? And then we're gonna do, let's see, $27,500 a year. Okay, perfect. So, and then age, and then you can do male, right? Male, female, if they smoke. So what you want to ask on the household income is, what is your before taxes income for 2020? What are you projecting you're going to be earning for 2020? Not 2019, not the current year, but the next year. So you got to go to the next year. This is the projection for next year. And it already tells you that this person, 35-year-old male, qualifies for $135 in savings. And if you drop down, you can add the spouse, you can add the dependents or kids, and you can see over here basically the plans, right? Like this plan original price is $333, but because they have the subsidy, it's only $97 out of pocket. but the deductibles are high. See? So what you want to do on the deductibles, once you get to bronze, silver, and gold plans, these are going to be obviously the best plans, right? Let's see a silver plan. Let's see a silver. Perfect. So on the silvers, you can see that on this county, we have I'm better, and obviously each link that is underlined gives you a description of what is. So when it says, hey, your estimated all in is, this is an estimate of what your annual out-of-pocket cost will be, calculated based on the plan's premiums for 12 months, your healthcare usage, and see the detailed pages if you want more information. Out-of-pocket, this is the description, and then you want to see if the drugs are covered, if the doctors are in the network, and what type of benefits. And then you can get the plan details. You can do this very, very, very easy. Just picking up the deductibles. You can add this to a cart, and then you can start the application. Once you start the process of application and you're asking the customer the information, then you will have an option to email the customer so they can click and finish the process of buying. That's why most health customers have an email, and they understand completely how that happens. The lower the deductible, the more they're going to pay for the plans. I'm better. We have a lot of different plans, but you see, we get to the Blue Cross and Blue Shield, very good plan. And then you can add, if you like, the dental to it. So if they want to coverage of dental, hey, $27 in addition to, you can add that to the cart if you like. Let's say that the customer says, well, I want this plan with them better. You can tell them we have plans with them better, and we have plans with the Blue Shield. And then the customer will probably tell you, I like them better, or I like Blue Shield, or it really doesn't matter to me as long as it covers and my price is good. So this is where a customer might say, well, I like the $214, but I don't want to pay the big deductible. How can I get help with that? General to the quoting link right here, and you have this login, and you can actually go and put a quote together for that same. I'm gonna go 35 years old, male. So I'm male and 35 years old. It's born in 1984. You would be the same age as the person that's getting a subsidy, because if they wanna, you can tell them we have a plan to cover and take care of your deductible. Obviously, you put the starting date. You usually go on the two 12-month terms, so their payment never doesn't go up in 24 months. That's why you want to pick the 12-month terms. They can go up to 3, but you start with the 2 because the price will not go up or increase in the next 2 years. So you see that on the health product does not have a subsidy, so the product is going to be, but it doesn't have a subsidy, but the out of pocket, or the out of pocket, or the monthly premium, it's kind of like the same. If you notice, this one is $214, but this one is $211 without a subsidy. But the only difference between this plan, this one is what they call a short term, because it's only 24 months. This one they can keep it as long as they want. This one, after 24 months, the price is going to move up because they have to requalify. Okay? And it already tells you here that with this plan enhancer, 5,000 for sickness and accident and hospital, it's telling you right here for $48, they can cover the plan enhancer, covers the deductibles, helps covers the deductibles. So we have, let me see. So let's say that you are my client and you pick this one. I would immediately say, do you need any dental coverage with that? Or do you need, we have a plan enhancer, which is this one, tells you right here, plan enhancer for up to $5,000 for sickness, hospitalization, that would take care of your deductible if you become hospitalized, or do you need to cover those deductibles? And the only deductible left on your plan would be $250. So you can add this and you can actually, enroll the customer on this one, $48 and $214. So for $260 per month, they would have a plan that would cover the deductible up to $5,000, which would cover the $4,200. And then they have a plan now that the only out of pocket would be $250. But let's say that they want, look at how inexpensive is if they want to cover cancer, or if they want to cover insurance, life insurance for $25,000, term life insurance for $10. So this is the chance for you to order. Look at the dental, the basic, the intermediate, $26. So you can add the dental, the accident, the indemnity, critical illness, all these plans you can go ahead and add. And every time you sell one of this, because each one becomes a different plan. So let's say that you are able to say, hey, Mr. Customer, so you want dental intermediate, you want the plan enhancer, you want a cancer plan that would take care of your cancer, heart, and stroke for $16. So over here for $87, now you got 1, 2, 3, 4 products that you're getting paid on. Go to the YouTube. So really go to the playlists, and I need you to look at the National General like we discussed. Main plans are going to be the plan enhancer to cover deductibles, hospital expense, how to build a package, and the quick tutorial. So you're going to spend 1 hour watching this, the first 5 or 6, but the last 2 have to do with the subsidies and the Obamacare or ACA product. Every call that you making right now, and with, do you already have a health plan? Because we also can give you a quote for your health insurance. So, or we can send you a quote depending on what you like to see. And we can actually, you can click on several plans, and the customer can compare, because you can email straight from here.